Today we're going to learn how to initiate an IV. We're going to start off with a little bit of math. Our doctor's order is at the top, normal saline at 100 ml per hour, and we're going to fill in the blocks on our math equation. We're going to start off with the first block here, how many mLs, and that's 100. Take that right from our order. And then drops per milliliter, we're going to look at our IV tubing. And for this particular patient and math problem, we're going to use a drop factor of 10 drops per ml. So we'll fill that in. And then over how many minutes, and of course that's always going to be 60 when your doctor's order is in this form per hour. And then we're going to do our math, and you may use a calculator to do that. 100 times 10. And then divide that by 60. And what do we get? 16.666. And what we're going to do for IV math is, we're always going to round up to the whole number. So our answer is going to be 17 drops per minute. Okay? So let's move on here to the medication room where we're going to set everything up. We want to make sure we have the correct solution, and we're going to look at our doctor's order. Normal saline. So I have normal saline. Do your medication checks. Make sure you have the correct name on the bag. Make sure that it is not expired. The solution is of a clear color and the bag is intact. It will come in a plastic bag. And then I also have my IV tubing. We discussed that we're going to use a drop factor of 10. I have my labels, and I have supplies to flush the IV site, which includes normal saline. I've done my 3 checks on the bottle. Make sure that it's not expired, the solution is clear. The solution in this bottle is good for 24 hours when it's a multi-dose vial, so make sure that it is time and dated if it's already been initiated. I also have a 3 ml syringe, and I have the tip that goes on the syringe, a blunt cannula. And then I also have what's called a lure lock, which sometimes is included in your tubing bag. Tape, and alcohol, and clean gloves. We have our IV pull. Okay, so let's start by opening up our solution. Have a garbage can handy. I have washed my hands before I started this process. I'm going to label my bag. Labeling the IV bag includes putting on what's called a time tape. At some facilities, they will prefer you to use that. That will be put along the numbers, and then we can mark each hour where the solution should be. We also want to put a label on it that has the patient's name and their date of birth, and possibly their medical number, and that can be found usually in the chart. So we'll put that label on also. We're going to open up our IV tubing. Now remember, the IV bag is good for 24 hours. So we'll want to make a notation on the IV bag at the time that we started that. Remember, the tubing is good for 72 to 96 hours depending on where you work. So we have a label also for that. Let's take our roller clamp, move that up to the top, and then go ahead and close it off. I'm going to put my label on my tubing. It's going to be changed 3 to 4 days from now. I'm going to put the time on there and my initials. Okay. Then I'm going to take my lure lock. And remember, this is a sterile process. I don't need to wear sterile gloves, but I'm not going to touch any of the tips. I'm going to put that on the bottom of my IV tubing without touching any of the tips. Put that on there nice and tight, and then screw that on. Okay. Now I'm ready to spike my bag. I'm going to hold on to the bag nice and securely. Pull off the tip. Remember, the tips are sterile. And go ahead and spike that into the bag. And that might take a little bit of strength to push that in there nice and tight. Okay, I'm going to hang my bag up on the pole. The pole is a little bit lower just for teaching purposes. Remember, on your patient, the pole would be a little bit higher. Now what we're going to do is prime our tubing. And you can do that over the sink in the medication room. You can do it over the garbage can. We just want to make sure we keep this above waist level because this is a sterile tip. So go ahead and take the cap off, hold that securely. Hold the tip of the IV tubing securely. And don't forget, before you open up your roller clamp, squeeze the drip chamber or you'll have a lot of air bubbles. Squeeze it about half full. And then go ahead and open up your roller clamp. And that should just take a second or two. It'll prime for you pretty quickly. So be prepared to close off your roller clamp before you waste your IV tubing, before you waste your IV solution. Okay. Close that securely. Go ahead and put your cap back on. And then you can just hang this over the top of the pole. There's a little clip here. You can put it on. You just want to make sure that nothing touches the floor. So let's hang it up here. Let's go ahead and prepare our flush. Again, I've checked my solution 3 times. It's normal saline for flushing. Clean that top off with alcohol. Open up your syringe. The tips are sterile, so don't touch. Open up the blunt cannula. This makes it all a needleless system. Screw that on nice and tight. Go ahead and remove the cap. Pull down on your plunger. 2 to 3 mL is sufficient for flushing. We'll want to try to avoid touching the inside of the barrel of the syringe. Just use your fingertips to pull down on the bottom of the plunger. We now have that filled with air. We're going to put that into our normal saline bottle. Push the air in, flip it over, and then go ahead and pull out your 2 to 3 mL of normal saline. You might want to go a little bit past, give it a couple flicks, and then push it back just to get rid of any air bubbles. Okay, go ahead and put your cap back on. We're going to go to our room now. We're going to take with us our normal saline, which we will have put a label on the syringe. Most facilities have a pre-made label. Our alcohol, tape, and some gloves. Okay, so let's go on into our patient's room. Identify our patient. 2 identifiers. We have washed our hands. I'm going to go ahead and put our clean gloves on. I'm looking at my IV site, checking for any swelling, redness, tenderness. I'm going to go ahead and flush it with normal saline. Remember to always alcohol wipe your tips before you put your syringe into there. Clean that real good. I like to leave my alcohol wipe underneath to collect any drips or drainage. Securely hold on to the IV site or the PRN adapter. Insert your syringe, and nice and slow, go ahead and inject your normal saline. At that time, be also checking for any leaking or any pain at the site from the patient, redness, swelling. Any tenderness while I do that, Mr. Cross? No? Okay. Good. And then what we're going to do is put that right into the biohazard. Okay. Now we're going to hook up our IV solution. I'm going to alcohol wipe again. I have my tubing right here. Remember, the tips are sterile. Hold on to your PRN adapter And on your IV, you have to kind of push down on the sides of that lurer lock. Kind of opens up the tip there. And then you can securely put that into the PRN adapter. And it'll clip around there. And then let's go ahead and open up our roller clamp. Get a little bit of solution flowing, just nice and slow, just to make sure it works. Okay, does that feel okay? Okay, I'm going to tape it to make it a little bit more secure. What I like to do is kind of tape the tubing a little bit, kind of pucker the tape around it, and then tape that onto the patient. That way we don't have the IV tubing making a dent into their skin when it's taped too tight. Alright, now our next step is going to be to count our drops per minute. And remember, our drops per minute are 17. So I'm going to make sure I have my bed in the lowest position so that my drops will be accurate. I'm going to count 17 drops per minute. And then using your roller clamp, go ahead and adjust the speed to make it quicker or slower. You might want to start off counting 15 seconds worth of the drops. So just divide your number there by 4. Okay, and then after you have that completed, you're all set. And that's how you initiate an IV.